The U.S. Senate Special Committee on Aging will now come to order. So this is my first committee meeting to chair. I've been up here 6 years. How about you? Yeah.
First one.
Yeah. So.
And I've been here 15.
So it wasn't. I just got lucky. So I want to thank everybody for being here. It's a pleasure to serve as the chairman for the Senate Special Committee on Aging for the 119th Congress. I look forward to working with Ranking Member Gillibrand and all our colleagues in this committee to highlight the issues facing older Americans and how the federal government can be more accountable to the American people. This is something I've been focused on since my time as governor of Florida. I'm excited to have the opportunity to continue this work as chairman of the Special Committee on Aging. My goal for this committee is to make sure every American senior is able to answer yes to this question, to these questions. Are you well? Because they have secured these four things: their physical health, financial security, a safe community to live in, and family and community support. If you have all four of these things in your senior years, it can be the best time of your life. Now, I'd like to welcome all the new members, or all the members of the committee. Ranking Member Gillibrand of New York. Also, so we've got new member, Dave McCormick from Pennsylvania, Coach Tommy Tuberville, fellow Governor Jim Justice. We've got Andy Kim from New Jersey. So, and we've got some others that I'm sure will be here a little bit later. Aging is not a partisan issue, whether we like to admit it or not. We're all aging. It impacts every single one of us, regardless of political party. And I think we're all trying not to age. I believe we have a big opportunity in this committee to work in a bipartisan manner to support and improve the lives of America's current senior citizens and create change that improves both their lifespan and health span of future generations. It's pretty exciting when you look at the conversation about what we're talking about, food safety and medicine safety and all these things. It's an exciting time. I think about how my work here will impact my grandkids. I think all of us think about our kids and our grandkids, and it drives what we do. I want them to have every opportunity to live the American dream and have long and healthy lives, mostly around me. My staff and I are excited to work together with all the members here to find common ground and ways we can advance our shared goals. I'd like to recognize Ranking Member Gillibrand now for her opening remarks.
Thank you so much, Mr. Chairman. It's a delight to be in this committee. Thank you for all the new members for selecting this committee. I think it's one that's highly relevant for everyone in the United States, but looking at the Senate itself, it's quite relevant for us. So I'm grateful that you're here. I'm excited to serve as the ranking member in this 119th Congress. I want to thank Senators Casey and Braun for their committee leadership during the 118th Congress. The committee examined many of the important issues that we are hoping to continue to work on together. Senator Scott, congratulations on your position as chair. It's a big deal, and it's very exciting to get to serve with you. We have a lot of ideas in common about what we want to do with the committee, and I think your agenda that you've laid out is really inspiring and really important and really urgent. I'm pleased to welcome both new and returning committee members, and I'm really excited to hear your perspectives, what you've learned from your state, what you've learned from your own families, what you've learned in your own lives. I think having interested and committed aging committee members makes a huge difference in what we accomplish as a committee, so I'm very grateful for your leadership. This Congress, I hope to continue to work on lowering the cost of prescription drugs, guarding against financial scams, protecting the programs that older adults and people with disabilities rely on, like Social Security, Medicaid, and Medicare. And today we are discussing how to promote wellness among our older Americans. We'll address issues like accessible housing, financial security, engagement in the community. This conversation is about making sure that we are creating and supporting a society that gives people the tools to live and to live well. Those tools are different for everybody, but includes resources like nutrition assistance, area agencies on aging, centers for independent living, supportive housing programs, Medicare, Medicaid, and Social Security. I believe that our job is to make sure these resources exist and are robust enough to support those who need them. I look forward to hearing from our witnesses and discussing ways to improve wellness for older adults and people with disabilities. Thank you, Mr. Chairman.
Thank you, Ranking Member Gillibrand. Now I'll introduce the first witness. First, I'd like to welcome Sheriff Bill Promell from Charlotte County. The sheriff serves as the president of the Florida Sheriff's Association and has over 25 years of experience in law enforcement, beginning his career with the Charlotte County Sheriff's Office in 1992. In 2015, when I was governor of Florida, I had the opportunity to appoint him to serve as a commissioner on the Criminal Justice Standards and Training Commission, and he sits as a member of the Officer Discipline Penalty Guidelines Task Force. Thank you for being here to discuss the importance of public safety and ensuring older Americans in Florida and across the nation can achieve wellness in their senior years.
Thank you. Chairman Scott, Ranking Member Gillibrand, and members of the committee, thank you for inviting me to testify. Today, I would like to outline ways in which the Charlotte County Sheriff's Office is working to serve and protect our senior population. Charlotte County does have a very large senior population. Our average age is about 58 years old. We implement several programs within the Charlotte County Sheriff's Office. Now, the ones I'm going to discuss here, they're not going to give you the wow factor, but they are programs that make a difference in my community. One of our programs we do is a senior outreach program where we have our volunteer unit call members within our community twice a week. We've also provided Christmas gift and birthday cards with these weekly phone calls. And the participants are over 60 years of age, disabled, or living alone with little or no contact to the community. So we're making sure that somebody is contacting them each and every day, each week. And if we don't hear from them, there's a scheduled time in which we contact them. If we're unable to get in touch with them, we send somebody out to their house to make sure that they are okay. We also have the population, they tend to wander at their age, and we have the Take Me Home program. Is designed to assist deputies in locating loved ones who have gone missing or lost. Information about your loved one, a recent photo and description is registered in our system. If the individual wanders or goes missing, this information is shared with the road patrol deputies immediately upon dispatch in an effort to locate and reunite the family. Any office member can register a participant to this program. In addition to that, we have our DNA Scent Kits. It's a program that enables participants to keep a DNA scent article at their home in the event loved one goes missing. Charlotte County Canine deputies use that pure scent to begin a track in order to locate the loved one and reunite them with family. These are handed out by the Community Affairs team, our mental health unit, and our patrol members. Project Lifesaver serves as a premier search and rescue program locally operated by the Charlotte County Sheriff's Office and is strategically designed for at-risk individuals who are prone to wandering. The program uses GPS tracking bracelet to locate the wandering party quickly. Another thing that we do on a regular basis, we have these in each one of our offices, is our Operation Pill Drop. It allows individuals to drop off expired and unwanted medication in drug receptacle boxes at participating district office locations. This keeps family members and others that might have access to a senior's medicine cabinet from getting those old, unused medications. We have special vehicle decals. We provide free decals for individual vehicles to alert deputies of a possible presence of someone that may require special attention within the vehicle, such as a hearing impairment or autism. This way, the deputy knows how to approach the vehicle and there may be somebody with a disability inside of it. A real simple program we have is often seniors misplace or leave items behind, such as their keys. Through our local lockout program, key tags are provided to help return lost keys to the owners. The tags are registered with a special code in our system with the owner's information. So if they're found, they're turned into the sheriff's office, and we contact the owner through that registration number. We educate them to not only put their name, not to put their name and address on the keychain in order to protect themselves. Then we have our Citizen Police Academy, which is big for our entire community, but it is attended mostly by our seniors. The classes are mostly seniors to learn behind the scenes and promote our volunteer program. The class lasts about 9 weeks long, and they learn a lot about our different programs within our community policing class. A lot of our outreach, we do spend a lot of time visiting local retirement homes to advise of the local scams and problems that we see. In addition, we rely heavily on Facebook, Instagram, our blog, and press releases. We know that many seniors do not monitor this, but many family members and those that work or live around seniors do. This helps us get the word out to them to watch out for their neighbors. In addition to that, we get out there and we educate banks and large retailers in reference to the different scams going on, because often the seniors will go to the banks to make large withdrawals, or they'll go to these retailers like Walmart and Target and start buying large gift cards or phone cards. And by educating these individuals, they know to alert us when somebody is trying to do that. Lastly, we focus our effort on speaking to neighborhood watches, local churches, and various organizations such as the Parkinson's Group. We average about 1 or 2 speaking engagements a week. We work closely with OCEAN, which stands for Our Charlotte Elder Affairs Network, which is a group of business owners in the senior arena that want to specifically help seniors. Currently, we are seeing several different methods in which criminals are attempting to scam our senior population. This includes scammers visiting our website, looking up recent arrests, and then calling family pretending to have the ability to bail out the arrestee. We are also seeing that is what is referred to as the romance schemes, which can be long-running and generally include a person asking for money while pretending to love someone. Other schemes that have become more pronounced center around sweepstake lotteries where individuals have to play to win. In these cases, the scammers will ask for gift cards to pay the taxes to get people their winnings. The Charlotte County Sheriff's Office is partnered with Charlotte Behavioral Health Care for addition of a caseworker to be assigned to the CCSO. This caseworker receives referrals from deputies who, during the course of their business, identify a senior who might be in need of services, as well as calls from the public. This caseworker will refer and/or provide services through Charlotte Behavioral Health Center and/or make additional referrals to outside entities depending on the elder's needs, or office provides a number of resources, including case management assists by giving brief overview of the program, provide the contact number, and in some cases provide hands-on assistance. Case manager follows up by phone if required, and case manager provides case management contact information for additional assistance if needed. Some of the organizations we use are home care providers, transportation, family service center, St. Vincent de Paul, Active Age, it's a daytime senior care, senior placement services, social service resource center, Florida Rural Legal Services, Meals on Wheels, Senior Friendship Meals, CapTel, Dementia Alzheimer's Caregiver Support Group, and the Dubin Center, which is also a support group for caregivers. And we have more than 90 partners that provide an array of services to our seniors and disabled. The needs of our seniors are not one-dimensional. If there's a need and we can't provide it, we find somebody that can. And I think by a lot of the programs we do, we hit those 4 bullet points that you mentioned earlier when you opened. So thank you, Chairman Scott and Ranking Member Gillibrand, for holding this hearing and focusing on senior population. I look forward to working with members of this committee to develop proactive and effective ways to protect our communities from crime.
Thank you, Sheriff. Now I'd like to recognize Ranking Member Gillibrand to introduce the next witness.
Thank you, Mr. Chairman. Maria Alvarez is the Executive Director of the New York Statewide Senior Action Council, Inc., a grassroots, consumer-directed, and governed nonprofit that has been serving communities for over 52 years. She's worked with senior citizen groups as an organizer, advocate, and director of housing and caregivers program for over 30 years. She's designed and implemented educational, social service, and leadership programs for older adults. And she's worked with me on my working group on aging, contributing to important policy priorities. In addition to her work with Statewide, Ms. Alvarez is a board member of Ponce Bank, which serves underserved communities in New York and New Jersey. Under Ms. Alvarez's leadership, Statewide has played a role in bringing awareness to the importance of economic security for elders, age-friendly banking, enacting the New York State Observation Status Law, the Safe Patient Handling Law, and refunding of the New York State elderly pharmaceutical insurance coverage. Recently, Ms. Alvarez has advocated for funding for New York's Patient Rights Helpline and the state's Managed Care Consumer Assistance Program. Under Ms. Alvarez, Statewide's federally funded Senior Medicare Patrol has served to alert and assist millions of New Yorkers to avoid Medicare fraud. Ms. Alvarez has also weighed in with the New York State in favor of home and community-based services through local area agencies on aging. Ms. Alvarez also holds a bachelor's degree from Marquette University and a master's degree in nonprofit management from the New School for Social Research, where she's a Sloan Fellow. Thank you very much for coming today, and thank you for your advocacy and expertise and leadership on such crucial areas important to this committee for the older New Yorkers who are able to age with dignity and security. I'm honored to have taken the time, have you take the time to be my first witness on this committee.
Thank you so much, Chairman Scott and Ranking Member Gillibrand, for inviting me here to come speak with you today. As a participant of the White House Conference on Aging in both 1995 and 2005, I can tell you that there have been dramatic improvements in the system of preventive care and health promotion, but we still have a long way to go. With your leadership and advocacy, we can continue to make improvements for the seniors of today and for future generations. Since 1995, the fabric of the older population has changed dramatically. This means that systems to promote healthy aging also need to change and modernize to better serve elders today. There's been a significant increase in the size of the older non-white senior citizen population, which is on pace to make up half of the elderly population by 2060. Fortunately, though, many elderly can remain in the community despite managing multiple chronic conditions. I suggest that one step in the right direction would be to make sure that the 2025 White House Conference on Aging is held to help the country chart a course for addressing the needs of this group, as 20% of this country is now of the age of 65 and over. Prior to 1995, Medicare and most private insurance would cover treatment of an illness, but not cover the cost of the diagnostic test or prevention. Thanks to action by Congress to improve Medicare in 1997 and 2003, and the implementation of the Affordable Care Act in 2010, coverage of preventive services has steadily increased. Now, most preventive tests and immunizations are available without copays, and Medicare provides an annual wellness exam to help beneficiaries identify health risks, schedule preventive tests, and identify social determinants of health. In addition, the country has invested resources through Part 3D of the Older Americans Act to provide evidence-based health promotion programs through the area agencies on aging and community-based agencies. Today, most communities have programs like Chronic Disease and Diabetes Self-Management Program and Falls Prevention. Many have been adapted to meet the needs of older persons of different races and ethnicities. These programs are cost-effective approaches and should be expanded. At one time, federal and state policymakers considered services like congregate and home-delivered meals, transportation, case management, and housing assistance as nice but soft services that were not as important as health care. It took years of advocacy and research to get the medical system to finally recognize the importance of social determinants of health, which are critical to the ability of older persons to follow needed courses of treatment and maintain healthy lifestyles. These are all important improvements that we can build upon, but we cannot ignore the need to recognize that having health care and preventive services available is not sufficient if they are not affordable or if discrimination, actual or perceived, persists. Many problems still exist. Income security continues to be a problem in a country where there's so much abundance. The reality is that 1 in 3 senior citizens are not making ends meet. Their incomes are under 200% of the federal poverty level, roughly $30,000 a year, and it is not keeping pace with the increasing cost of living. Lest you think that this is only one segment of the population, I will tell you that we increasingly see people who look good on paper, who consider themselves to be middle income, sliding into poverty at dizzying rates. According to several reports, we are about to experience the largest amount of homelessness in the elderly population ever. We are already seeing it in New York City. More Section 202 housing must be developed with social services attached to them. This will ensure that seniors not only have an adequate place to live, but they have access to all of the programs and services for which they qualify. I cannot end my time without telling you that along with Social Security, Medicare, and Medicaid, the Older Americans Act is a law that has had a seismic effect on the elderly population. All of those programs form the framework that seniors can rely on to continue to thrive and live in dignity. Now that this generation makes up 20% of the country, we need to strengthen and improve them in their structures as well as in their funding to reflect the fabric of our country today. I have many other points to make, and 5 minutes is just not enough. I hope that you ask me about them during the time that we have together and consider us a resource to you in the future. I have also included a full list of programs and recommendations with my formal testimony. Thank you.
Thank you, and thank you for being here. Next, I'd like to welcome Dr. Dawn Carr. Dr. Carr is the director of the Claude Pepper Center at the Florida State University and serves as professor of sociology. Her mission as a scholar and gerontologist is to identify and leverage factors that bolster older adult ability to remain healthy and active as long as possible. Before joining Florida State University in 2016, she was a researcher at the Stanford Center on Longevity, a postdoctoral fellow in the Carolina Program for Health and Aging Research at the Institute on Aging at the University of North Carolina at Chapel Hill, and a researcher at the Scripps Gerontology Center. Thank you for being here today to discuss the impact of community engagement on the physiological and emotional well-being of seniors.
Thank you, Chairman Scott and Ranking Member Gillibrand and the rest of the committee. It's an honor to be here today and to have an opportunity to share my testimony with you. I am the director of the Claude Pepper Center, and this is a wonderful center at Florida State University that is named for one of the strongest advocates for aging policy in U.S. history, Senator Claude Pepper, and I think he would be very excited about the work that you're doing here today. Today, I'm here to discuss with you the importance of expanding the scope of U.S. aging policy to increase chances that future generations of older adults not only survive into old age, but they can thrive once they get there. Health problems in later life are strongly influenced by events, exposures, and behaviors that occur well before we reach our later years. Although the consequences of regular harmful exposures and habitual behaviors accumulate to erode health over time, there's growing evidence that if we intervene early, we can significantly modify health trajectories. Current clinical care is not designed with this approach, and there will be significant consequences if we do not change our current approach. Older adults who are navigating the period of old age when health problems interfere with daily function, a period sometimes referred to as the fourth age, often experience poor quality of life, and they lose the ability to live independently. The needs of this group vary starkly with older people who are healthy and able to engage in a variety of active, meaningful, and purposeful social roles. This is the period sometimes referred to as the third age. This distinction is important because there are stark differences in the needs of a typical 65-year-old and a typical 85-year-old, but also systematic differences in the health and function of older adults of the same chronological age. Much of our current aging policy is focused on problems related to the fourth age. Further, middle-aged adults today face more significant health problems and disabilities than previous generations. In the absence of significant changes, they are likely to face more complex health issues in later life than previous generations, and they are likely to enter the fourth age even earlier. Our society could instead be enriched by a large and growing group of healthy third-agers if we leverage an aging policy framework that emphasizes health maintenance at every stage of life, targeting risks related to aging-associated diseases and disabilities, engages older adults' unique strengths that benefit society, and addresses barriers to healthy aging that create inequalities in health outcomes as people age. I believe the following 4 areas are especially important: employment, social engagement and social integration, health literacy and lifestyle behavior supports, and healthcare access and early treatment. First, regarding employment and financial security, working in later life is protective of health as people move into and through the third age. However, older workers are less likely to be hired, offered opportunities for upward mobility, or offered opportunities for training. In addition, individuals in physically demanding or hazardous jobs are more likely to become disabled or retire early, with significant financial consequences. Implementing health protective occupational interventions where possible and midlife retraining for transitions to new career paths can increase the chance that workers remain healthy and fully employed until they reach full retirement ages. Further, making phased retirement or transitions to part-time work opportunities available to all workers will make it possible to remain engaged in paid work longer. Second, social isolation and loneliness accelerate physiological aging. Isolating older adults within communities is not only detrimental to the health and well-being of older people, it also prevents communities from benefiting from their skills and wisdom. There are very few programs designed to reach isolated older adults. Effective programs like meal delivery programs are low cost and have the added potential of improving access to high-quality, nutritious foods. Expanding these programs is likely to delay onset of disability. In addition, increasing engagement and volunteering not only is health protective, it also helps people of all generations work collectively to solve social problems. Investing in volunteer infrastructure is not only beneficial to health outcomes, it can provide exponential returns economically. For instance, the Senior Corps volunteer programs have shown an estimated return of between $3.50 and $5.08 for each dollar invested, with the added bonus of reducing burden on the healthcare industry. Third, most adults in the U.S. do not have access to scientifically accurate information or resources they need to gain access to a third age. One important solution is expanding the number of community health workers, which offers one of the most effective solutions for facilitating healthy behaviors across the life course by helping community members of all ages build trust with the healthcare system and navigate healthcare services to support healthy aging. Recent research suggests that there is a $2.47 return for every dollar invested in community health workers for the Medicaid program alone. Further, lack of access to high-quality, nutrient-dense foods is a persistent problem reinforced by ultra-processed, unhealthy foods being subsidized so they are low cost. Making healthy foods financially accessible and disincentivizing consumption of ultra-processed food is key to increasing healthy aging. Last, most adults do not see a doctor regularly unless they're facing health problems. We need scientific investments to identify ways to halt disease progression early. This means recalibrating health benchmarks at all stages of life to support long-term, optimal health trajectories. For instance, aggressively treating metabolic and lipoprotein health in middle-aged adults has been shown to reduce risk of dementia, diabetes, heart disease, and cancer, the most costly and consequential aging-associated health conditions. This approach will require more frequent interactions with healthcare providers, but it has potential to significantly pay off. A recent study showed that a metabolic and lipoprotein pharmaceutical intervention provided a 5-year return on investment of nearly $10 for every dollar invested. In conclusion, to build a future that is enriched by a robust population of healthy third agers requires us to expand our aging policy priorities to intervene during critical inflection periods so we can modify health trajectories and bolster physiological resilience as we age. If it becomes possible for all adults to remain productively and socially engaged in meaningful ways into late life, old age could become a period of life that we all look forward to and our society as a whole will benefit. Thank you.
Thank you, Dr. Carr. Next, I'd like to recognize Dr. Susan Hughes. Dr. Hughes is a professor at the School of Public Health and directs the Center for Research on Health and Aging at the University of Illinois at Chicago. Dr. Hughes is a gerontologist and health policy analyst whose research focuses on the design and testing of evidence-based health promotion programs for older adults. Thank you for being here to discuss the impact of physical activity on the overall health of older Americans.
Thank you so much, Chairman Scott, and Ranking Member Gillibrand, other members of the committee for this wonderful opportunity to talk with you today, testify today about this very, very important topic of older adult wellness. It's an honor to be here. In terms of my background, I directed the Center for Research on Health and Aging at the University of Illinois, Chicago, where I led 5 successive iterations of our NIA Roybal Center. Like other Roybal centers, we design evidence-based health promotion programs for older adults. Today, I would like to address the limitations of our funding for health promotion programs for older adults and strongly recommend the use of Medicare for that purpose going forward. Medicare, as everyone knows, is a wonderful program, served, millions and millions of people and greatly improved access to acute, subacute care. However, the designers of Medicare missed a major opportunity to cover wellness programs that have the potential to pay for themselves many times over. Medicare Advantage plans are managed care options that encompass 54% of beneficiaries. Medicare Advantage plans must offer all of the plans that regular Medicare offers, but they can supplement that package any way that they choose. The ability to supplement services makes these plans logical providers of health promotion programs. However, plans will only cover evidence-based programs if they see an advantage to doing so. We need help, the administration, good news is the Administration for Community Living and CDC have developed criteria for evidence-based health promotion programs. The administration we need help from Congress, to develop incentives for Medicare Advantage plans to include these programs as covered benefits. This will take time. In the meantime, the only source of funding for a growing number of evidence-based programs is Title IIID of the Older Americans Act. Fiscal year 24 funding for Title IIID was $33.6 million nationally. That amounts to $671,000 per state, or 31 cents per senior in the state of Illinois. These funds support care management and FALS programs. Currently, there is no set-aside funding for physical activity programs despite overwhelming evidence supporting their impact. 84% of older adults in the United States are sedentary and at high risk for obesity, diabetes, heart disease, and all-cause mortality. We know that any physical activity is associated with lower mortality risk. My work with homebound older adults found that arthritis was their most common chronic condition and the condition that interfered most frequently with their functioning. Our follow-up disability study found that persons who had lower extremity joint impairment were much more likely to become disabled. Once we understood the pivotal role of lower extremity joints, we developed an intervention to improve their function. Fit and Strong lasts 8 weeks. It provides flexibility, aerobics, and systematic lower extremity strength training and uses group problem solving with peers to promote physical activity. Our trials found significant gains in physical activity 8 weeks that were maintained at 18 months and accompanied by significantly improved joint pain, lower extremity strength and mobility, and decreased anxiety and depression at the same time points. Medicare spent $43,000 per total hip and knee replacement in 2023. Fit and Strong costs $300 per participant. It has no harmful side effects and large effect sizes. Drugs have a clear pipeline from bench to uptake. our growing number of evidence-based programs have no similar pipeline for distribution. We have no way to communicate program benefits to clinicians who can recommend them, and no way to reimburse program providers. Currently, Title IIID of the OAA is critical but insufficient to meet growing demand caused by more programs coming online. We need to reauthorize OAA, increase funding for Title IIID, and create a new title for physical activity. Currently, NIA and CDC are creating great programs that unfortunately have nowhere to go in terms of, a route for distribution. To impact older adult wellness, Congress needs to improve coverage of evidence-based health promotion programs by Medicare plans, by managed care plans. This effort would require a full-fledged partnership between the National Institute on Aging, CDC, the ACL, and CMS to speed up the process, hopefully, of disseminating programs that meet clear criteria for suitability for adoption. Thank you again for this opportunity to share our work with you. I hope this has been helpful and look forward to your questions.
Thank you, Dr. Hughes. Now we'll go to questions. I'm going to go ahead and pass my time to Senator McCormick.
Great. Thank you, Mr. Chairman, and thank you, Ranking Member Gillibrand, for kicking this off. And it's great to be here in the my first meeting of the Special Committee on Aging. This is a big issue for Pennsylvania, where I'm from, and my predecessor was the chairman of this committee. So it's an issue very near and dear to the hearts of Pennsylvanians. My first question is for you, Dr. Carr. You alluded to the research on part-time work opportunities in your written testimony. What are the benefits of someone choosing to remain in the workforce? And what are some of the barriers that older workers face as they seek to remain in the workforce?
Thank you for the question. So one of the clear benefits of part-time work is obviously being able to be paid longer. And oftentimes it's not possible to work full-time, or it's very challenging as we get older because there may be some physical health problems that people need to address, making it more difficult to maintain that full-time workload or caring for other family members. So there's a lot of reasons why part-time work is helpful, and it's meaningful. So all of us in this room, I think, have jobs that are extremely meaningful that we would be very sad to give up because it gives us a lot of sense of meaning and purpose in our life. Those things are both helpful because they make us feel good, but also they improve our physical health. A lot of work I've done over the years with my colleagues has shown remarkable protective effects on physical health as well as cognitive health with continued engagement in paid work. So that alone, I think, is an important piece by itself. And we also find that the health effects, health benefits of working are roughly the same for part-time work and full-time work as we move into later life. So if you think about effect sizes, part-time work is quite potent in lots of ways. Regarding the barriers that you mentioned to continued part-time work, there's a lot of different kinds of things, and certain groups of people face more barriers than others. It's easy if you're in I'll say a high-ranking kind of role to negotiate a singular opportunity to maybe consult or move into a part-time job, mentoring others, doing things of that nature. But for a lot of workers, there aren't many choices that pay sufficiently or are meaningful enough for it to kind of be worthwhile or even available as an option, except hourly work or maybe stepping back and doing work that isn't very cognitively engaging. And so that lack of opportunity, we don't have a lot of I'll say, institutionalized opportunities for people to take on or transition to an intended part-time role. It's more haphazard or one-on-one basis.
Yeah. Thank you. Sheriff, a question for you about, you made mention of scammers taking advantage of all of us, but in particular focusing on the elderly. What are some of the protective measures that you would recommend, particularly for hoaxes that are telephonic? What can people do to protect themselves and recognize the potential scam call?
Well, you know, the best defense is a better offense, because we got to get out in front of this, because a lot of these scams are very, very difficult to track down. Many of your offenders are not just outside your state normally, but they're outside the country. What we try and do, especially like with the jail scam, your IRS scams, things like that, is we try to give, tell everybody to give a safe word. So this way, if somebody's calling you saying, hey, little Johnny, I'm arrested in jail, I need bail money, there's some sort of safe word that they both know that person is going to use, so that if the scammer, of course, isn't going to know that safe word, so they're not going to know to use it, and the person on the other end will catch on to that and realize it's a scam. But the most part is we just educate in every way possible and to everyone possible, because, as you stated, everyone's being scammed, but our seniors are especially being targeted.
Thank you.
Thank you, Senator McCormick. Next, I'll turn it over to Ranking Member Gillibrand.
I'd like to defer my time to Senator Alsobrooks.
Good afternoon. First of all, thank you to Chair Scott and to Ranking Member Gillibrand for convening this really important meeting. I am enthusiastic about joining the Senate Special Committee on Aging and really pleased to be here today. I want to thank all of our witnesses who've come today. Thank you so much for your presentations and your work and all the information that you shared. As the daughter of two aging parents, I have witnessed, like so many, some of the challenges that our seniors face. Our seniors have spent their entire lives, many of them, working to earn benefits such as Social Security and Medicare. And I view these programs as a promise that we have made to our seniors. I am committed to ensuring that every senior, regardless of their background or circumstances, has access to resources and opportunities that they need to thrive. And with that, I'll begin my questions. I'd like to say to Ms. Alvarez, direct the first question to you, that like so many Americans, I'm a part of what they call the sandwich generation, which means that I am both caring for a 19-year-old daughter as well as my aging parents. And while I'm really grateful for the opportunity to support my parents and understand the rewards that come with caregiving, I also recognize how challenging it is to bear the full weight of caregiving responsibility. Now, we know that many federal programs that are so critical to our seniors and that guarantee the support and stability that they need are really in jeopardy. And so in Maryland, we have over 1.2 million residents who are over 60, and the Maryland Department of Aging oversees a range of these programs, but Maryland also relies heavily on federal funding. And so I wonder, do you believe that volunteer-based organizations who we rely on very often have either the capacity to adequately fill the gaps that would be left by reduced federal funding, and do you believe that these organizations likewise have the obligation to provide that care, particularly in states like Maryland, where federal programs are vital to seniors?
Hello. Okay. Thank you very much for that question. So to answer your question, right now, if there's a reduction, if things stayed the same, if the funding stayed just the same, just by the fact that we have a larger senior population and more aging in every single day. There are 10,000 people who turn 65 every single day in this country. So with no increased funding and more people to serve, that constitutes a cut. So just starting from that point, I would say that we can't afford not to increase the funding. Decreasing it would put us in a crisis. And then when you're talking about the mission of organizations that manage volunteers, that's their mission. And my organization also, we're volunteer-based as well. And it's our mission to do it. And however, being realistic, we have to be able to marshal our resources effectively so that we can do a good job and be responsible in our work. With less funding, or even with less funding, it's not possible, right? We are constantly thinking of ways that we can get more people, because there are people out there who are very well-meaning and who want to do the work, but we also have to have the wherewithal to administer all of this work with volunteers coming in, as well as the job at hand, which is an increasing senior population.
Thank you. And next, Dr. Carr, I just have a question also for you. And the question is regarding the cost of increasing of prescription drug medications. This is yet another area where I have seen really so much struggle. As I mentioned, my parents, my father is my mother's caregiver. And one of the things I note in Maryland is that, and around, is that nearly 90% of all of our seniors take prescription drug medications. We also know that over 20% report that it's extremely difficult to afford those medications. And we know that access to affordable prescription drugs is not just about health, but it's about dignity as well and peace of mind. So the question is, how can we ensure that our seniors will have reliable access to affordable prescription drug medications?
Yes, I agree that making sure that everyone has access to the medications that they need is extremely important. I don't have a clear history of studying prescription drug costs, but I can say that in order for us to be able to maintain a healthy aging population, inadequate access to prescription drugs will undermine our efforts. The scientific advancements in pharmaceuticals are astonishing and playing a big role in helping with prevention at all ages. There's lots of room for pharmaceuticals to play a strong role in coordination with other healthcare efforts to ensure healthy outcomes. In terms of financial supports, it would be largely undermining to the efforts to ensure a healthy aging future if we did not have financial support for all of the pharmaceutical needs of older adults.
Thank you, Senator. Now hear from Senator Tuberville.
Thank you, Mr. Chairman. Thrilled to be on this committee with you. You laid out a great vision for the committee. Are Americans doing well? We should have some great hearings. I think most Americans would respond to that question with concerns or worries. Americans are not just seniors, are concerned about their safety, health care, finance, nutrition, and stability for communities. The fact that so many Americans are concerned about their general welfare is unacceptable. We live in the most abundant country in the world. Anxieties about things like public safety, harmful chemicals in foods, financial security, and retirement security shouldn't be at the forefront of Americans' minds, but they are. Elites in Washington have ignored these concerns for far too long, and the American people are tired of it. So when President Trump's election, Republicans take back the Senate, we're going to leave no stone unturned, thanks to our chairman. I want to make sure that when Americans are asked about their wellness, they respond with hope and optimism, not fear and anxiety. So I look forward to digging into these with you, Mr. Chairman. It should be fun, should have a good time, and maybe we can make some progress. Sheriff, real quickly, I know you hit the spam and the robocalls. I've gotten several spam texts as we've been sitting here. It's annoying, and I'm sure to seniors who are retired, sitting around, they get absolutely sick of it. You've had work with this. What can we do on the federal level to help this? Is there anything that we can do to eliminate some of this garbage?
You know, I don't know if we're ever going to be able to eliminate it. because with the AI and with all the different technology that are coming up, they're using technology to commit the crimes, and we're trying to use the technology to catch them now. So we're trying to keep up. Problem is a lot of legislation, both on state levels and federal levels, isn't keeping up with technology. It's years behind.
Yeah.
So that's a big thing that we need to look at is legislation and technology. You know, when people receive phone calls and all that, now they can spoof numbers, so they can use a number that is very familiar with them. They can, I mean, we have people that use the sheriff's office number when they're trying to do the jail scam, because they can easily spoof the numbers. It's just trying to keep up with technology. We really need to get a handle on it.
Yeah. Dr. Hughes, we've got a serious nutrition and wellness problem in this country. Serious. You know, can you speak of the importance of a lifestyle in earlier years to help our young people understand what they're getting ready to get into in later life?
Yeah, I think that's a great question. I think we have a real opportunity to educate people, you know, early on, develop a life course perspective to health education, physical fitness, you know, so on and so forth. It's going to be, you know, far more cost effective in the future if we can get people to adopt, you know, good, healthy nutrition habits, physical activity, other, you know, types of activities that will really, really improve their functioning and quality of life as they age.
Yeah.
And into old age.
You know, our young people don't have as good as we've had it growing up because we use fresh food, vegetables. They eat all this processed food now. I don't know where it's going. I hope we can get a handle on that. I really do. Dr. Carr, whether it be friends or family, what is the significance of community and social engagement?
Can you repeat that question? What is the significance?
I'm going to read it myself.
Okay.
Again. Whether it be friends or family, what is the significance of community and social engagement? In other words, what can the community do? Not just your family, but your community and your social outcome, you know, boyfriend, girlfriend, husband, wife. I mean, how can that all work together to make us have a better, longer life?
Well, it's been very interesting over the last 20 years because I think for the first time, scientific efforts have been able to show that friends matter a lot.
Right.
The growing research showing mortality consequences of loneliness and social isolation have really accentuated our understanding of why relationships matter. And I think for a long time, things like friendships and family relationships were thought of as sort of soft, not real health behaviors.
Make a huge difference.
Yes, but I think that there's clear evidence, and sometimes when I talk to people and they say, what are the key issues when you think about longevity? And I put social health, broadly speaking, at the top of that list.
Yeah.
And that isn't just you have a good marriage or you have a few good friends, but the interconnected relationships we have within our community are heavily related to that. So if we're in a community where we belong and we're able to have our needs met and work as part of a team, like I mentioned, I think in my testimony, solving problems together, those are really powerful relationships that help us feel like we matter and we have a place in the spaces that we're in.
Yeah. I won't ask this to anybody. I'd just like to put it on the record that, you know, and hopefully we'll talk about this in the future. Americans are suffering from a record-breaking $1 trillion of credit card debt. Trillion. And what can we do in the future as a group to take
The highest
things?
interest rates for credit cards ever. Also.
Pardon?
I think it's the highest interest rates for credit cards ever in the history of the
yeah.
country, too.
Interest rates and the debt, and we just keep racking up. People are broke, they don't have cash, and so
Yeah, it's
that's
highest
going to be a
credit card
huge
debt in
problem.
history and highest interest rates on credit cards
Yeah.
ever.
Thank you, Mr. Chairman. Thank you very much.
Senator Kim.
Yeah, thank you, Chairman. Thank you, Ranking Member. Thank you, everybody, for joining up here. I appreciate it. Dr. Carr, I think I'll just pick up where my colleague was getting at. You know, this issue about loneliness, issue about mental health in particular, and I think that that's something that is becoming all the more apparent in our society. I think we have a mental health crisis as a nation right now. It affects young kids. I got a 7-year-old and 9-year-old. I'm worried about that generation, but just kind of all throughout this. And from my standpoint, it feels like we don't have the workforce that we need right now to be able to address this. So I guess I just wanted to get a little bit more a sense from you of just, you know, what are some of the best practices? Are there certain states or communities that are doing this better? You know, things that we can draw on? Because, you know, it's hard to, you know, we don't want to reinvent wheels here, but if there are certain things that we can lift up to a federal level, you know, I'm interested in trying to explore that. So I just thought I'd kind of tease that out a little bit more from you.
Yeah, I mean, I agree with you that we don't have the resources we need to address the growing mental health issues that we're facing as a nation. And it is getting worse, and the pandemic was a big spike that hasn't really recovered fully in that regard. In terms of specific case examples, I'm actually think that's a wonderful suggestion for the work that we should be doing is identifying some communities that are getting it right. And I'm not familiar with any specific individual communities. I will say that communities in which there are opportunities for people to have all of their basic needs met are doing much better than ones that are suffering in terms of issues with high levels of unemployment and poverty. And that's partially because there's this connection with having meaningful roles and connections and being able to connect with other people within the community. Volunteering is one of the ways that a lot of people have been able to maintain those relationships in and above and beyond having those basic needs met. And I think that places where there's a lot of intergenerational engagement, this is particularly useful to a healthy, sort of social fabric. But with this recommendation, I'm going to be looking for some great communities that provide excellent examples that we should be able to look at to see
and
if we
I'd
can
love to
elevate
stay in
them.
touch with you about that.
Yeah.
Mr. Chairman, I think that's something that this committee might be able to do is really try to draw upon these different issues of mental health and financial situations, others, and try to, it's hard here in Congress to come up with something completely from scratch, right? A new, completely novel idea. But if there are pilot projects, if there are other examples that we can draw upon, scale, try to exemplify, that's something that we can lift up here in this work. So I hope that we can have a chance to work together on that. And Ms. Alvarez, I guess a similar-ish type question. I'll be honest, if you don't mind, I'll be a little personal here. I was listening to one of my colleagues talk about she's part of the sandwich generation. I am as well. My father had a major accident last summer, is not able to walk anymore, and now having significant cognitive decline. We're really struggling with this. And I think, Ms. Alvarez, one thing that I wanted to raise with you is the thing that really stood out to me was the difficulty of our family trying to get a sense of where we can turn. What is my father eligible for? What other types of services are available, resources that are out there? And even navigating Medicare. I mean, I'm a United States congressman at that time. I was having so much trouble just trying to navigate. I can't imagine what other Americans have to deal with. So, from your standpoint, working in New York, what have you seen as sort of the best examples of getting that information out there? And the challenge is often that it's, at least for my family and many I talk to, you're often experiencing some of this in an emergency situation where things have changed dramatically in your life. Is there ways that we can try to ramp up better, try to prepare people better so that it's not just under this crucible of pressure and emotion in terms of trying to get to it? So I wanted some of your thoughts here.
Yes. Thank you so much for bringing that up. In statewide, we operate 3 helplines. And so a lot of our work, we're a grassroots organization, and a lot of our work is going out into the community. And many times they're hard to reach populations. They might be ethnic minorities, there might be rural areas. And so we are constantly reaching thinking of ways in which to outreach to different areas. We've gotten to the point where we're doing a lot of ads in the newspapers because we know that seniors like to read the newspaper. We do radio interviews and a ton of outreach into the community through tabling events, fairs, anywhere they invite us. We're statewide, as the name connotes. But it's also important not only to reach the senior, but the caregiver. So what you're talking about is the family, the caregiver, the friends. It's very important because many times those are the people who are assisting or even making decisions, depending on what state the person is in. And I will say, in response to if you're looking for a community, a project that works, we're very proud of a project that we have with our Senior Medicare Patrol program, where what we've done is to reach out to community organizations, community-based organizations that are trusted sources in the community. And working with them, what we do is we train people that they identify, people who are active in the community, who they, and so we train them on different issues, who then go speak with their peers. The best, I always find that the most effective way of reaching out to others is through your peers. You're gonna listen to your friend. And we ask them. We don't dictate what it is that we want to do. We have the content that we want to communicate, of course, which is the fraud and health and things like that. But how they want to be communicated to, with that is up to the community. We go to the community and we ask them. They know best, and that's not only that they know and they're trusted, but also that they are then empowered with information. They can go out, they become leaders, and they're empowered to go out. So it's a mixture of a lot of things. And so, and the other thing I wanted to follow up a little bit on what Senator Alsobrooks was.
If you don't mind, keep it brief. I don't want to go too long over, otherwise the chairman, I don't want to
thing?
cause trouble in my first hearing. So yeah, it would
Just
be
one thing.
brief.
It's on me. The family caregivers. No, it's a statistic. Very important. I want to say, is that it's family caregivers on an average spend about 20% of their own income on the person that they're caring for the senior. And it's important to, we were talking about financial issues before. It's important to note that, because then that might put the person caring for the elderly person or whoever in jeopardy, and they're not able to build wealth, or they'll be in more debt moving forward, and they'll be worse off than the person they're caring for when they finally need it. That's all I wanted to say.
Well, thank you so much. I appreciate you.
Senator, you know who should be helping you is your health plan should have a healthcare advocate that should be able to help you navigate that whole system.
Yeah.
I mean, that most of these, especially these bigger companies, they have a whole program now of advocates that are supposed to be helping. Because how would you know? I used to be in the business, and people call me all the time because I was in the business. But other than that, you're not going to become an expert.
Yeah.
But that's where it should be done. Senator Johnson.
Thank you, Mr. Chairman. As you're well aware, I'm kind of a late entrant onto this committee, and I mainly joined because you became the chair, and I think you laid out a pretty good vision for what you want to do with this committee. It'll come as no surprise to you. I think my committee members will quickly learn that I'm not a real fan of the federal government. I think it causes or exacerbates more problems than it solves. I think the question you'll hear repeatedly out of me, I've certainly heard a lot of support for government programs. I think my overriding question always is, what is the negative unintended consequence of a well-intentioned program? I'll lay one out. I'm currently working on a program, or my project. We're trying to make sure everybody's aware of how much the federal government spends. In 2019, total government spending was $4.4 trillion. Then we had the pandemic, shot up to $6.6 trillion. Now, if you're a normal family, if you have an illness, your spending dramatically increases, you get well, you go back down to the previous level. We didn't do that. For the last 5 years, we've averaged $6.5 trillion. Last year, we spent about $7. It's completely unsustainable. The result has been the devaluation of our currency. $1998 is now worth 51 cents. The 2014 dollar is now worth 74 cents. The 2019 dollar is now worth 80 cents. I could ask you the question, how much more devastating is that devaluation of a senior's wealth compared to the loss of one government program? The mismanagement of Social Security is profound. Social Security, when it was first established, I think the retirement age was set at 65 and life expectancy was less than 62. Now, being 69 myself, I'm really glad life expectancy has increased, but with that increasing life expectancy, you end up with Alzheimer's, you end up with more cancers, you end up with some really difficult problems that we're all trying to solve here. I appreciated Senator Tuberville's comment about social intervention or interaction, community. I think that's been a recurring theme, that is like sort of the #1 solution. Strong families, supportive communities. That doesn't come from the federal government. So I guess I just kind of want to at least have everybody think of the federal government programs you're advocating for, the costs of those things, helping drive a $1.8 trillion deficit. I mean, is there, if we want to prioritize spending on seniors, and again, we're a compassionate society, we want to help people who can't help themselves, and seniors are often in that category. What other spending can we put down the priority scale and not do? I have to admit, my mission as a U.S. Senator is to wean as many Americans off government as is possible. So we can rely on our families, we can rely on our communities, because that's really where the solution lies here. I mean, I'll end on this now. I just kind of want your comments. Part of the isolation we're finding is if everybody thinks they can just get a quick check from the government, nobody has to really feel responsible for mom and dad. And so people become more and more isolated, the less and less they're connected to their community or even dependent on their family and their community. So I'll start with you, Dr. Hughes. Just can you comment on some of the points I made there?
Okay. Thank you.
Got to press that button.
There you go. Okay, sorry. Tech challenge here. I think that there's a number of, I understand where we're headed, with the current deficit. And obviously, it's not, it's huge. It's not trivial. We have issues with, maintaining Social Security, the future of Social Security. There are also a lot of people out there working on this problem. And, what I've read is that it is not an insurmountable one. There's a group at Boston College that's headed by Alicia Manel, and she's a person she's a health economist who has she spent her whole life, working on this issue. And, she's basically come up with some relatively, simple, straightforward, ways of kind of getting us.
So can I?
Yeah, go ahead.
When I mentioned the mismanagement of Social Security, you realize we took all that surplus money, and we had lots of surplus money for years because there were tens of workers for every retiree. Now we're down to under 3 to 1.
Right.
But we didn't invest that money. We spent it. It's gone. And in its place are government bonds, which really have no value to the federal government.
Right.
Now, had we invested those in something like a Dow Jones index fund, which didn't exist back then, but we'd literally, this is a couple of years ago, we'd have $8 trillion in hard assets. But we didn't do that. We spent it.
Right.
It's gone. It was mismanaged. Again, that was the federal government did that. And the other unintended consequence of that, we led seniors to believe, boy, just get to the age of 65 and we're going to pay for your retirement. We're going to pay for your health care. I don't know any senior that can really get by on just Social Security benefits. That's a poverty-stricken life. But we kind of lead people to believe that because we really don't educate them. We don't educate our kids. Go, hey, save for your retirement because you're not going to want to live off what Social Security can provide. And oh, by the way, we've kind of bankrupted it anyway, and it's not going to be able to provide all those benefits in about 10 years anyway. Professor Carr.
Well, I would I would disagree that the program is going to be bankrupt anyway, respectfully. I think that there are things that we can do to keep the program solvent. I'm unfortunately not a health economist. This is not my area of expertise, but I know there are people out there who are working very hard on this. They have some very good ideas about how, how we can increase the share from people who have more wealth, for example, in terms of their contribution to Social Security. There's, we've already increased the retirement age. There are other things, that we can do along that line as people become, healthier and have longer life expectancy. I think that it's of course, a very, very, very important issue, and one that everybody should be very concerned about and trying and working very hard.
I'll just relentlessly point out how the government has screwed it up time and time and time again. And again, the definition of insanity is doing the same thing over and over again, expecting different results. I mean, continue relying on the federal government to solve these problems. I think we have to find different solutions. So thank you, Mr. Chairman.
Thank you, Senator Johnson. Senator Kelly.
Thank you, Mr. Chairman, and congratulations on your new role, and the same to you, Ranking Member Gillibrand. I'm glad to be returning to the Aging Committee. This Congress, almost 1/5 of Arizona's population is 65 and older, and that number continues to grow. And I think it's pretty simple. Arizona is a great place to live, to raise a family. It's also a great place to retire. It's got great weather, especially this time of year. And I'm looking forward to continuing to work with my colleagues on this committee to make sure that that stays the case. And one of the things we can do is adequately fund senior programs and services, making healthcare more affordable and accessible, and by giving people the ability to choose where and how they age. And I want to take this opportunity to remind any of my constituents who happen to be watching that my office here and in Arizona, we are here to help. And if you need some help with a federal agency, and that includes a problem with your Social Security benefits or an issue with the VA, we're here to help. So please go to my website or give us a call if you need assistance. I know we've got 2 big years ahead of us in this Congress, and I'm looking forward to making some positive change for Arizonans and folks across the country. So my first question here is for Dr. Carr. First I see in your bio that you're an ASU grad. One of my kids went to ASU. The other's at U of A. And in your testimony, you mentioned meal delivery as an example of a low-cost program that has a very valuable impact on older adults, especially those who are socially isolated. And this is something we heard a lot about as we worked on the reauthorization of the Older Americans Act. Many of our area agencies on aging in rural areas of Arizona have a lot of interest in home-delivered meals, and yet they have to put folks on a wait list for these services. And for some organizations, this is the first time they've ever had to use a wait list for meals. And that's one reason why I was glad that our bipartisan Senate-passed Older Americans Act reauthorization included more flexibility for how local agencies can use their nutrition funding, allowing them to move more money toward delivery if that's what the local community needs. In the same spirit of meeting people where they are, last Congress, then Ranking Member Braun and I introduced legislation to help food banks be able to provide delivery services for the senior food box. This got a great reception in Arizona, and I'd like to put it out there that if any of my colleagues on this committee would like to work with me on this year, I am more than willing to do that. So Dr. Carr, could you talk about why these kinds of programs are so valuable? And from your perspective, Why are they important for Congress to continue to support?
Thank you for that question. And yes, I'm an Arizona State grad, and my brother went to the University of Arizona, so you can imagine what that's like sometimes. I also want to start by just saying one of my earliest memories is going in the car with my grandmother, door to door, delivering meals with these programs. And it was a big part of our family growing up, making sure to volunteer and to help support other people in the community in the Tempe area where we grew up. I think of the home delivered meals programs as kind of the secret sauce of kind of a foundation for healthy aging, because it does a whole bunch of things at once. It has the opportunity to help make sure that people have food, which we know is important. It promotes social engagement. And we know with some colleagues I know at other universities who are really big experts in this field have shown that the more frequently a person gets a home delivered meal delivered to their house, the better the outcome, because there's more frequent interaction. And those small bits of social engagement are potent in terms of their benefits for feeling less isolated and more connected and feeling more valued in the community. And the person delivering the meal also gets benefit from the volunteering and engagement in the community, and they feel valued. So there's almost no program I can think of that has those combinations of things that are so collectively relevant. So I think, if there was a program that could have more impact, I can't think of one that is as inexpensive as this one could be to expand.
Yeah, it's interesting. You get a added benefit from doing this. I mean, the food is the goal. I experienced this as I delivered meals during COVID, and I saw, multiple, seniors multiple times, and I could tell that they were getting something out of this beyond just this delivery of lunch and dinner. So, thank you. I'm going to have a couple questions for the record, Mr. Chairman. Thank you.
Thanks, Senator Kelly. Senator Warnock.
Thank you very much, Chair Scott, and congratulations on holding the first Aging Committee hearing of the year. I look forward to working with you and also with Ranking Member Gillibrand together this Congress. Far too many seniors are struggling with high out-of-pocket costs for medications that they need to live. And that's why I've been laser focused on reducing prescription drug costs and improving access to health care. I'm proud that my bill included in the Inflation Reduction Act lowers the cost of insulin to no more than $35 per month of out-of-pocket costs for seniors. And that as of January 1st of this year, seniors will not pay more than $2,000 in out-of-pocket costs for their prescription drug coverage each year. I can tell you as a pastor that I've seen the impact that this has on the lives of ordinary people. I've seen it up close. I'm proud that this spending cap was made possible, again, and included in the Inflation Reduction Act. Dr. Hughes, how does lowering out-of-pocket prescription drug costs actually help seniors who live on a fixed income? I think often in government we talk about these things in theoretical terms, but give us a clear picture of the human impact of this.
Well, we all depend right now on prescription drugs. Prescription drugs have almost replaced regular routine medical care in terms of their life-saving and health maintenance effects. So these are a lifeline. And for people who are, because of income constraints, unable to get a medication renewed and/or have to make a choice between rent or food or something else and a needed medication, that shouldn't happen. It shouldn't happen to older adults. It shouldn't happen in the United States of America. And I just think that this Medicare, the Deficit Reduction Act has really just been great in terms of, you know, the prescription, you know, the inflation, excuse me, I've got the words wrong, the Inflation Reduction Act, okay, has really, really been a great piece of legislation, and I think it has enormous potential to help a lot of seniors. So
I agree with you. I think it makes a huge difference, and I agree that seniors shouldn't have to choose between prescription drugs, which they need, and food on the table, which they also need. And so I look forward to building on this and working on it, not only as a member of this committee, but also as a member of the Finance Committee, where a lot of these issues related to costs and seniors comes up through the various programs that we have. I'm grateful for Senator Casey's work last Congress to champion the issue of Medicaid home and community-based services. Medicaid provides coverage for home and community-based services that allow older adults and people with disabilities to receive the care that they need from the comfort of their home without going broke, paying for it. However, in Georgia, over 7,000 people are on waiting lists to access these services. So we have the Better Care, Better Jobs Act last Congress to enhance Medicaid funding, but folks are still on the Medicaid list. Dr. Carr, how would cuts to Medicaid proposed by some of my colleagues affect access to home and community-based services for our seniors?
Yeah, so Medicaid and home and community-based services are an actually more cost-effective way to help care for older adults with disabilities than nursing homes. And one of the challenges is if people don't have the care they need, it can spill over onto caregivers, family members who are providing the best care they can, which can be problematic because then they may also be unable to work themselves, which I think has ripple effects that are consequential for families. And then I think we would anticipate that in the absence of receiving care people need at home, they're more likely to go into a nursing home. And even if people do have money saved and they're not yet on Medicaid, within 6 months, they're usually spent down to Medicaid. And that's very expensive for our system, and it doesn't meet people's needs that they want, which is to stay in the community. So I think the consequences of not allowing people to have the services they need to stay in their home and get care for as long as possible is the most cost-effective way for us to protect Medicaid costs, among other things, not the least of which is supportive of quality of life for older people.
Thank you so much. So it's fair to say that this has an adverse impact, not only, certainly on the seniors, but also on their families, and not only on families, an impact on all of us through the ripple effect. Thank you so much for your testimony, and I look forward to continuing to work on this committee and also the Senate Finance Committee to make sure that we protect Medicaid and other critical programs that our seniors rely on.
Thank you,
Mr.
Senator.
Chair.
Sheriff, what role do you see for law enforcement in promoting healthy aging and supporting older adults to remain active and engaged in their communities? Do you think there's any role for law enforcement to be involved?
Yes, I do. Like I said, you know, we're out there engaged with our community. My philosophy is that you deal with quality of life issues within your community, and if you deal with the quality of life issues, they won't explode into crime issues. And we have one of the lowest crime rates in the state. But you have to stay engaged with your population, whether they're kids or whether they're seniors. We have a great volunteer program, and we encourage all of our retirees to come join our volunteer program. And we have a volunteer program of about 70 members. So they come in and, like has stated, they have a purpose. They're out there helping the community. They're giving back to the community. They're staying engaged with us. And in the same sense, they become part of our family. And we check on them. Even when they come to the point where they decide to retire out of our volunteer program, they're still a part of our family. We're still checking on them. We're still making sure that they're okay and they're getting what they need.
That's great. Ms. Alvarez, your organization runs the Senior Medicare Patrol for the state of New York. What are some of the fraud trends that you've seen?
There's so many frauds that we have a fraud of the month. That's how much fraud there exists.
Yeah.
Recently we just had the durable medical equipment fraud, where somebody might call you and ask you if you want a back brace. Somebody just calls you on the phone. Well, we know that a back brace is something very personal that should be, prescribed by a doctor that knows you. And then recently we had somebody who received like 50 back braces because somebody got a hold of their Medicare number and charged it to their account. There are other forms of if there's anything happening in society, there's a fraud for it. So, for example, when COVID started, that fraud really skyrocketed. One of the things what they were saying was that if you have, because there's COVID, you'll get a new Medicare card, and we'll send you a test along with it. And we're going to send you a laminated card. We're going to send you all sorts of different frauds. The reality is that there's no new card, right? That you get a card and that's what you have. It goes on and on. Anything that's happening, there's a fraud for it. I always say that while we get up in the morning to do valuable work, a scam artist, that's their job. And if they were doing something productive with their time, they would be very successful.
Thank you. Dr. Carr, how does participating in activities like paid work or volunteering impact the psychological or physical health of older Americans?
Well, there's a lot of evidence that both are protective of physical, psychological, and cognitive health. With regard to volunteering, there isn't a lot of specific research that says, here's the thing about volunteering that makes you better or improves your health. And there have been a lot of researchers that have been trying to figure out sort of why it works, one of which there's some initial evidence is related to the fact that when you help other people, you actually respond better physiologically to stress. So there's sort of a buffering effect of being engaged in your community to feeling better when you face everyday challenges. That's not the only issue. Imagine just like working, you're more physically, cognitively, and socially engaged when you're engaged in volunteering. And that is largely the reason why we think that remaining engaged in those activities are so good for your health over time. And I had mentioned earlier, 20 hours a week of work is pretty protective, and it really depends on what kind of work that is. If you're engaged in really physically demanding or dangerous work, it's not health protective. It has to be work that allows people to be able to maintain their health and be able to be engaged. So it's important to keep that in mind.
Ranking Member Gillibrand.
Thank you. I just want to congratulate the chairman on such a wonderful panel. Each one of you has had such important information to contribute, and I think all the senators feel that you were exactly the right people to answer their questions. So thank you very much for your expertise. I just have a couple. I want to focus a bit on the financial security issue, even though we have talked a lot about it. Obviously, Social Security is one of the most successful and popular programs ever enacted, and tens of millions of older adults use their Social Security benefits to buy groceries, to buy their medicines, to pay for housing, to just basically live on. For many older adults, their Social Security benefits are insufficient, and they have a difficult time making choices. And we've talked about some of those choices between heat and food and medication and not taking their medication or spreading out their medication inappropriately. I've heard about a lot of real horror stories of people just trying to make ends meet, and we heard some more today. Ms. Alvarez and Dr. Carr, can you amplify a little bit some of these tough choices they have to make? And how does it affect their well-being? And particularly, I imagine it affects their mental health. When you are struggling on the basic needs that you need to survive, that must provoke enormous anxiety. So I want to talk a little bit about how we can amplify or expand upon financial security to take away some of those burdens. And I'd just like your insights on that.
Well, first of all, seniors are constantly juggling. If you're on a fixed income, many times they're constantly juggling their finances. It's between, they say, well, can I get away with not paying for my prescription drugs and, cutting them in half, things like that for a month? Can I get away with not paying my rent for a month? And we all know that constant juggling at one point is going to come to a head, where if you just simply do not have enough money coming in and you have to pay bills, things are going to collapse. So the programs that the Older Americans Act actually, has, those are all programs that shore up people who are who don't make ends meet. We work with this Elder Economic Security Index, and basically in New York State, not New York State, in the country, in the United States, the average Social Security income is $29,678. So that's the 200%, a little bit less than 200%. But it costs more money than that to actually live on an average in any community in the United States. So when we have heating, when we have the SNAP program, when we have the MSP program, the Medicare Savings Program, when we have those things, people are able to then benefit from programs that will keep money in their pocket. The Medicare, one concrete thing I want to say is that the Medicare Savings Program helps with out-of-pocket costs with for your health insurance and your prescription drugs. It pays for your co-payments, things like that. And it's calculated that if a person is not accessing one federal program, they're not accessing 4 other federal programs. That's an average of $7,000 that somebody could have in their household with, and so that they don't have to spend money on. So because we have these programs, that's what's going to keep people in the community with dignity if they don't have those
Absolutely.
Those programs.
Dr.
Thank you.
Carr?
Yeah.
And do please expand on the Older Americans Act and why that matters.
Sure. Well, I'll say a couple of brief things. One, I don't think we want to live in a society where we allow old people to suffer in poverty. And these programs are really critical to ensuring that that's the case, but they don't solve the problems entirely. Second, being poor is really bad for you in every aspect. And last, poverty is not the consequence of something you do wrong in old age. It's a lifelong effect. And so a lot of these things that we see with older adults is due to things that have accumulated over the course of their lives. And in later life, we don't have the ability to many times go out and recover financially when things go wrong and we've run out of money despite our greatest efforts. So these are really protective of the most vulnerable people who have needs and want to stay in the community. And the Older Americans Act is critical to ensuring that we don't have a massive group of people living in nursing homes because they have no other choices. And I think that in the absence of other opportunities, we can't place these burdens on families or communities in other ways. So helping support people with these relatively small interventions by allowing them to stay in their homes is beneficial to the larger community.
Agreed. Dr. Hughes, you look like you want to add something. Would you like to add something?
I'm sorry, could you repeat that?
Do you want to add something to the conversation of
Yes.
why fixed income is
right.
such a challenge, especially at $30K a year,
So,
and Older
thank you.
Americans Act being important?
Thank you. I appreciate the opportunity to speak to this. The Older Americans Act is part of the fabric of our society, the services that it provides and funds. And there are so many communities in the United States that really depend on these services. I think part of the problem is that they don't understand, a lot of people don't understand where the money is coming from. If they knew, where it was coming from and why, I think that there would be much greater groundswell
Support,
of
yep.
support for
That
these
makes sense.
programs
Yep.
going forward. I think that the meals, there's no question about the home delivered meals
Yeah.
being
The
huge,
best. Yeah.
hugely valuable. They were hugely valuable in Illinois during the pandemic. There is research showing that they reduce emergency department use, they improve nutrition, they do all kinds of things. What is really amazing is how much the Older Americans Act has achieved with so little
Yes.
in terms of resources, okay?
Yep.
And I think that that's an amazing success story. And my testimony was really attempting to build on that and just, provide more if we could.
I agree. Thank you, Dr. Hughes. With the chairman's permission, may I ask Sheriff Pramel one question about fraud? So, Sheriff, I really appreciated your testimony about the work you do in your community, and it is so much appreciated. I've heard so many stories about seniors who have fallen to these scams, the grandchild scam, the IRS scam, the cryptocurrency scam. They're literally endless, and they're heartbreaking because our seniors are duped, and they either take money out of their bank account, they send money through multiple means, but it's so rare that we get this money back. And I've also talked to law enforcement up and down my state and across the country, and they have very few tools to go after these transnational criminals because they're sophisticated criminal networks that are using the internet, using the phone, using data and information like who just got arrested, as you testified. What can we do to crack down on the scams more? And is there any way or anything we should be doing to get justice? Like, let's just say we can't defeat the Chinese network of scammers. Like, should we be doing something to make sure the victim is given some measure of relief? Should we create a fund for that? What would you recommend? Because you're dealing with the crime and not being able to arrest or put someone in jail most times.
Yeah, and that's the problem, because like I opened with, is most of your criminals, they're not just outside the state, they're outside the country, and they're outside the reach of local law enforcement. Your federal agencies, they have a little bit more far reach, but they won't touch a case unless it reaches a certain dollar amount, which I understand because their plate's full with all the other responsibilities.
Do you know what the dollar amount is?
I think it's close to $1 million.
Oh, so that's not going to help anybody.
No, that's
So
not
every
gonna help
scam I've
anybody.
ever heard is a $5,000 scam or a $10,000 scam. I've heard a few where bank accounts have been completely eliminated, but it's usually $100,000 or $200,000.
Yeah, it usually doesn't reach that dollar amount, but I understand because you can't flood the FBI and the Secret Service with all these fraud cases either because they have other responsibilities, but the problem is too, is it's heartbreaking because you do see a lot of people, they're duped out of their life savings. They worked hard for that money for retirement, and then now all of a sudden it's gone. And 99% of the time, it's not recovered. You will have some of the financial institutions, very rarely will, depending on the dollar amount, will reimburse the victim partial or all of it, but that's rare. But there is no set fund, at least that I'm aware of, that will help reimburse or get that victim back on their feet.
Thank you, Mr. Chairman.
Can I just follow up? So I think what Ranking Member Gillibrand and I both care about is all these frauds, right? I was talking to, I don't know who it was the other day, but they said if you go to 50 years ago, whatever time frame, the FBI put a lot of effort into bank robberies and things like that because the local sheriff's offices like yours wouldn't have had the resources to do it. Today, if there was a bank robbery, you don't really need the federal government to help you, I assume, right? So what you really need is you need help on issues like this. So has there been any conversation by law enforcement to say, that was great that the FBI, Department of Justice, whoever helped us 50 years ago. We don't really need their help anymore. Maybe Union County in Florida does, a small county, but you don't need it. right? And they ought to focus on these things that you don't really have the resources to do and you don't have the authority to handle. Has there been any conversation with law enforcement on that?
There's really been no discussion that I'm aware of. We're involved with a lot of the federal agencies with regards to investigations that do cross over the borders, but mostly they're focused on terrorist-type investigations and drug enforcement type investigations. But as for the fraud investigations, we really don't have a task force. They have some task force with the Secret Service, but I don't hear much coming out of it.
So I think for both of us, if in the organizations you're involved in, if there's a discussion, or if you think we ought to have a hearing on that where we could have a real conversation about where should people focus their time? Because there's not unlimited dollars. I mean, nobody wants to pay more in taxes, so there's not unlimited dollars. But you don't need all the federal help in your county for a lot of things that they probably want to come and help you on.
No, I mean, most of the stuff within my county we can handle. But like I said, when you're dealing with these major fraud cases that cross not just state lines, but the country lines, we don't have an arm that reaches that far, and we don't have the technology to trace them. They can spoof these numbers. They can hide IP addresses, so it's not as easy to trace them anymore either.
You basically need the NSA and the CIA.
Right.
Like, you need our
Yeah,
top.
but they don't
computer
take that resources and stop doing stuff that they don't need.
Yeah.
So, going to change the subject a little bit. Dr. Carr, then I think all of you have talked a little bit about we'll get a return on investment if we spend this money, right, on something. What about spending money on healthy eating? How much money would we save if we got everybody to eat healthy all their life, or start even when they're 65? How much has anybody done any study about the problems of ultra-processed food or excess sugar intake or things like that that would actually save us money on the other side? I was telling Senator Gillibrand, the problem I always have, like in my business life, if somebody came to me and said, okay, if you spend money here, I'll save money over there. It was easy. I just cut the money over there, okay, and spend it over here because I can make it happen. I've never, my job as governor of Florida, now my job here, nobody's come up with a program that actually saves money. They all cost more money. Mm-hmm. And unfortunately, how many of you guys want to vote for tax increases? Nobody does, right? Nobody wants our taxes to go up. So we have to figure out how to do this in a manner that, and healthy eating seems like a logical way. I don't know if you've done any research on that, or have you seen any research?
I'm not an expert in nutrition, but nutrition is one of the things that we know matters for lifestyle, broadly speaking, related diseases, and almost all of the major illnesses of aging are related to lifestyle. Nutrition's hard to study because we can't put people in a hospital for 30 years and watch them eat a certain diet and compare it over time. But we'd have learned a lot, and I think you're right to say that ultra-processed foods, as I noted in my testimony, is detrimental to health and costs us immensely. And there are certain kinds of things. You mentioned sugar. There are lots of different studies looking at the consequences of poor nutrition across a whole variety of different categories. Inadequate, protein consumption as we age, which becomes more important, and other varieties of things. But if you're talking about a nutrition intervention as a solution to save money, I can't help but assume that it would long-term save money if we found a way to make healthy foods accessible, easy to I'll say, encourage people to consume, and instead of the things that companies have helped us.
Yeah, and I'm not anti-sugar because I like everybody else. I like a nice chocolate dessert. But there's a way to do this. There's a way to have healthier sugars too.
Yeah.
Right. So
I agree with you, and I think that the challenge that we have in terms of saving money over time, which I think. I agree with you. We need to be paying more attention to these ways to save money by improving health over the long term. This is a long game when you're talking about these things, and it's if the federal government is positioned to start helping us play a long game with healthy aging, I am really excited about that, and I think nutrition is part of that equation.
Yeah. Dr. Hughes, the National Institute of Aging funded your research, the Fit and Strong program. You've shown that it's successful. What does NIA do with that data? What do they do with it? Did they just do the report? Or did they do something with it?
So we have been working with the Illinois Department of Public Health. We were very, very fortunate to get ARPA funding from them. And we've been able to basically disseminate the program all throughout the state of Illinois, including many rural areas. We also were able to beef up the presence of the program in Chicago through the same source. The Department of Public Health had public health money from CDC, and the City of Chicago people had funding from the AOA. We were able to use that money to get the program out to a lot of people in rural areas, to African Americans, we have a Hispanic version of the program, to people who really, really don't customarily access health promotion programs. In terms of national, we've worked really hard on disseminating the program. We now offer the program in 32 states nationally. Some of that is we had a partnership with the National Recreation and Parks Association to offer the program in collaboration with them, again, with CDC funding. So what I was trying to kind of get at with the testimony is the fact that everybody now who has an evidence-based program, you have to reinvent the wheel. You have to do it like all by yourself, and there's like no playbook, there's no cookbook, there's nothing, to kind of help people who are developing these programs, and they're developing them, to help older adults to improve their wellness, to improve their functioning, spending years, of their lives developing, these programs. And we're in a school of public health. It's just really, really always been important to us. If we find something that works, you have to get it out into the community where people can benefit from it. So that's been, kind of the motivating, force for what we do. And I think that this is a very, very important opportunity to think creatively about what we can do to maximize health promotion interventions. We've, for example, came up with a hypothetical case when we had to present before the Boston Consulting Group to get our funding from the Illinois Department of Public Health. We basically said, okay, if we were able to demonstrate a 3% reduction in use of total joint replacement surgery, the program would pay for itself, so over and over and over again. So I think these programs save money and they benefit people, and they're very, very cheap, and people like them. And, it's just, to me,
And you're doing good for people too.
Pardon?
And you're doing something good for people.
Yeah.
And it's not like you're not selling something that's bad for them.
Right.
So. Right. Do you have anything else you want to add?
I just want to thank the chairman, and I want to thank each of our panelists for their excellent testimony and for their outstanding insights on the challenges that so many of our seniors are facing right now. You're a real blessing. Thank you.
Right. I'd like to thank everyone for being here today and participating. I look forward to continuing to work with members across the aisle and down the dais. If any senators have additional questions for the witnesses or statements to be added, the hearing record will be open until next Wednesday at 5 p.m. Thank you, everybody, for being here.